Hi, Dr. Emer.
Hey guys, it's Dr. Emer, and we're in the clinic today. We are doing one of our just maintenance routines. Remember I told you guys, every 3-4 months, my clients come in, they do a little refresher. Sometimes it's the car wash treatment where we're cleaning off the skin, and sometimes it's just a little bit of a booster with some Botox and filler. So today, one of my patients, she already has a beautiful angled face. We've been treating her skin, it's looking great, but she loves having that arched brow, and she works out a ton. I'll tell you something, anybody that's out there, she can squat and leg press more than you. I'm telling you that right now. She's like 5 a.m. leg press guru over here. But what that says is the temples tend to get a little hollow. You can see mine are a little hollow because I've been hiking a lot. But hers have been maintained because we do filler there every 4 months, 6 months, a little bit, but also to the ridge of the brow. Because you guys know as you age, there's a fat pad right here and around the eye, and it tends to want to make the brow go down like this, which makes the eye look saggy, so we're going to put a little filler there to lift it. Some people use threads to lift it. Some people do all therapy to tighten the muscle. Here we're going to use filler. We're also going to just, who doesn't love plump, beautiful lips? So we're just going to keep her beautiful lips hydrated. I'm going to use a little filler there. So what I'm going to do in this area, I know, we love doing this, you guys. It's good. We're getting ready for the weekend. Okay, lift your head all the way up. We're going to use a cannula technique on the brow, and I like this because you can even see her vein right here, this vein. We just don't want her to bruise. And sometimes we use Juvederm, sometimes we use a little Restylane. All that matters here is a product that has some substance. You don't want to use a watery product here. We're going to go right along the brow ridge. Now, this is where we want the brow to be. And if you were to do surgically, you'd have to go in here and do a lift, cutting the muscle and lifting the brow. But we can support this area because she's just lean. We could support this area with a little filler, and you could see I'm using this cannula, which is a blunt-ended instrument. And really, to be honest, the technique for this has not really changed in the years that I've done this. It's just that if you use needles here, there's just a much higher risk of causing issue. And areas that are high vascularity or along the bone, you can see right here, I'm literally right on the bone, under the muscle. We're going right there in this specific plane, but it doesn't have a lot of pain. How does it feel?
Okay, that's good.
Someone says he sounds like Michael Kors.
Great, he's successful. Sounds great to me. So we're gonna go up in this little triangular area. So the fat pad goes like this. There's also fat pads in here for the eye. Those you don't want. Typically you get rid of those as you age through surgery or not. But here we're gonna give some support to the upper pad, and to lift the brow on the bony ridge, we need a little bolus right there. So we're gonna leave that there. We're gonna push that into the ridge. And you guys can see already, if you take a look at one side versus the other, it's more lifted. And go a little bit deeper onto this ridge and give a little volume here. And again, no real risk to the blood vessels there because we're using this cannula. Perfect, okay. So that's it, we're just gonna hold lightly here. I'm gonna switch with my medical assistant. We're gonna go to the opposite side, and we're gonna do that same thing. Let me see the one side. Take a look, you guys. If we drew a line right here, we went all the way across. Look how much lower this side is.
Feel it.
Yeah.
So you can see it's subtly lifted, but that's what we want. And what's cool about these fillers, specifically a Juvederm product, it will hold a little bit more water and get some substance, but because it's in the deep structure underneath the muscle, it's gonna stay in place.
Yeah, this one lasted really long.
Yeah, and you work out a lot, so what do you think? How long do you think?
This one lasted since November. It was a long
Really?
time.
So that's 8 months.
It was just amazing.
So 8 to 9 months, that's perfect. And a lot of my really workout fanatics and my Los Angeles fad diet groupies, you can lose fillers pretty quick in the face, especially the products that are not of the newer technology classifications like the Define, Refine of Restylane or Juvederm Voluma. You can see here again, look at the veins. See how thin? She's very thin, so you have to be super careful. Going right up on the bony ridge, giving some support. And again, we're gonna go right into that superficial fat pad of this lateral part of the brow.
I'm so excited because I know it's gonna look awesome.
I know, it's so funny. I didn't realize it's so long ago.
Mm-hmm.
It's crazy. It's gonna look awesome for sure. And then we're gonna go up into that triangular area. Again, it's just being in the right plane, taking your time, and because we're using a blunt-ended instrument.
And again, tell us what you're doing right now.
We're doing filler to lift the brow, but this is a specialized technique to give support on the bony ridge of the forehead.
Is this the only way to erase the brow?
Well, you can use other techniques that are not filler. Let's take a look. See, that looks great, you guys. You see how obviously a little swollen right now, but minimal. Lifted through here because there's support on the bony ridge. You can use filler in the temple to give a little more support laterally. You could use threads to lift here or to pull back in the cat eye look, the fox brow. You could also do Ultherapy to tighten the muscle, or Morpheus to tighten the skin. But I think that's perfect with a little bit of filler.
Now tell us why subtle is your specialty. Why
Subtle is my specialty, you guys, because people want treatments done without a trace. They want to walk out of here like nothing was ever done. My clients don't want the plastic doll look or the overdone look. They just want to feel natural. They want to feel confident and like nothing was done. That's why I made my new skincare brand, Emerage Skin, to be about courage, giving you self-confidence because you're putting amazing skincare products on your skin. It's not all about luxury, it's about high quality. And you guys, make sure you support EmerageCosmetics.com, the new launch of Emerage Skin. She's going to be doing my Aerify peel in 2 weeks, right? Which is only a few days. She's done other peels before.
27th we'll start.
Perfect. She's going to start on the 27th, and then she's done other peels, but we're just maintaining now. And Aerify is made to maintain after you've done facials, lasers, deep peels. You can do this every month. I've been doing it. Let me look at my skin. It's looking great. I need maybe a little Botox on my skin. Look at the quality, you guys. Look at the quality. That's the key. It's all about quality. So now we're going to go to her lips. Who doesn't love beautiful lips? And look, I love her lips. Lift up just a little bit because it has the perfect Cupid's bow shape, and it also comes down on an angle. So we don't want to create a sausage lip. We don't want to extend it too much, but we do want to give definition in the Cupid's bow. And you can see when I grab on here, there's some looseness there, a little pinch. That means that she needs some volume. And we're using silk. Silk is done a little bit, it's a softer filler, it's done a little more superficially. And we're just giving a little definition.
The little Tic Tac is back and he said he can't wait to try your skincare.
Cannot wait for you to support it, you guys. It's gonna also help charity, which we're so excited about. Hold on.
Now, what's the most ablative treatment you do for acne scarring in the body? Chest, shoulders,
Well, the
back?
most ablative treatment you can do is J-Plasma or Renuvion. For the anything below the neck, typically you don't like to do too strong, so you'd want to keep off the face a non-ablative treatment like a Fraxel or a Halo. For the face, you could do a CO2 resurfacing. We're going to switch sides. So silk is very watery, it's very smooth, and the thing I like about silk, you guys, is it's going to give her hydration in her wrinkles.
One more time, what did you use in the eyebrows?
Eyebrows, we did Juvederm Ultra Plus. We want some substance there. Right now I'm using silk because for some reason her lips, and we've done this before with other bigger products, tends to get a little lumpy. And that can happen. You move your lips, and some fillers do better than others. So you just have to have a good relationship with your doctor.
So you customize every treatment.
We customize every treatment, and if there's an issue, we figure it out. We work it out. So now we're going to create the Cupid's bow again. Okay, on the other side. And you could use a strut technique. Some people call this a picket fence. Some people call this a pillar technique. Where we're going to go directly in the edge just to give her a little lift. Sorry, I'm pushing on her nose and eye right now, but this will give her a little more lift. She gets hit on by so many young guys, so I got to keep her lips ready to go. Beautiful and ready. I like when her upper lip is a little plumper. So we extend it just a little bit. because it always gets a little more swollen. We'll give the bottom part of her lip a little more eversion, so we're going to go under and push it forward. Different technique.
Now, what makes this technique different than just injecting?
This allows us to give her more of an eversion and a more of a turn. Rather than just plumping, we're getting shaping. Okay, so we're gonna let that sit a second while that calms down. I'll show you guys, but take an up close look. Let them see. Show an up close look how beautiful that is. I'll do the Botox and then we'll go back. We're doing brows and eyes.
Mm-hmm.
Brows and eyes. Okay, and then the other biggest thing is let's lift the brow more by doing brow lifting with the Botox. So we do around here. Yeah.
Yeah, actually, yeah, I do because I noticed
Come into the corners. Okay, so we'll come around to tighten this, and that allows this to lift up more. So squeeze in as hard as you can. Relax. Good. Will you do me a favor? Wipe her under eye just a little bit with alcohol. Squeeze in again. Relax. Good. So we're doing a maintenance treatment, you guys. It should be done every 2.5 to 3.5 months. And we're using Botox on the glabella because this will paralyze the muscles in the middle. And then we're going to do a little on the edge of the eye to lift the brow because we just did filler there, so we want to support it.
How long do the little bumps last?
Those will go away in about 10 minutes. No big deal. Mosquito bites. And then we'll do our maintenance crow's feet. Smile as big as you can. Relax. And I like to do sometimes a matzo ball technique where I do a bigger amount right here. Remember I told you guys I'm from Chicago and New York, so my Jewish heritage. Smile as big as you can. Relax. We're going to go just a little bit to the under eye wrinkles. Very small amount so that the under eye improves a little. Good. Smile again. Relax. Good. So in this case, again, we're going to do a little bit of a bigger bolus right here. Smile again. And you can see that this is trying to move, but the Botox here will stop it. And we're going to do a little bit on the edge here. Smile again. Relax. We're going to go right underneath and just do 2 little pinches, nothing crazy. And then the rest we'll do as a bolus. Perfect. So that will diffuse all around here and help the Botox stop. Now let me show her lips. I'm gonna do, do you want to do a reveal or no?
Yeah, let's do it. I need chin in the background, so hold on, ready?
Okay, hold on. So obviously she's getting a little swelling from the Botox. Oh my god, the lips are perfect. Literally perfect. But obviously you guys, so with the lips, we created a little filter column. We lift the Cupid's bow, we extended the lower portion, and the brow we elevated. So go ahead, let's show her. Let you take a look now yourself and tell us what you think. How did Poppy do?
My Poppy.
Dr. Poppy.
My Dr. Poppy too.
Obviously without the bumps.
Great.
Ooh, those lips are amazing.
They're awesome.
Show them to the side. Show them to the side.
Now, are you in pain right now? Does it hurt? Are you in pain?
No, not at all.
Okay, blow them a kiss, all of them. Yes,
If I wasn't
and then what do you think of the brow?
The brow looks great.
Yeah, it's awesome.
Yeah.
It's
No, the
like
brow
we
looks
got that.
perfect.
So tell us what
That's
you
I
did.
want.
So let me show you.
Yeah.
So here, you take a look at here because it's a little bit easier to see.
Okay.
Lifted brow.
Oh, now I can really see. Oh, yeah.
I know, it's so good, right? We hit it, baby. We hit it.
Yes. I feel like I'm back to
I wish
normal.
I wish it wasn't COVID, so I could actually give her a kiss because we're
I
that
know.
close.
Now, how often do you have to get Botox when you start getting
Botox is
them?
every 2.5 to 3.5 months. If you work out a lot like her, it might go down a little bit faster. The filler is how often do you do your lips? A couple times a year? What do you
Gosh, I
think?
no, just twice.
Twice a year?
Mhm.
She likes them a little more plump, and the thing is, it fits her face. She has a longer chin, a higher cheekbone. It just structures. It doesn't look done. I like silk for her because it's soft, it's subtle and plumpy. And then she'll use obviously Lucy & Co. and other things to plump her lips from our Emer Cosmetic Lip Essentials package. And then Botox will numb this area so that it lifts a little bit more. And that's it. It's all about subtleties, guys, without a trace. The without a trace rejuvenation. Bye.
Perfect.
So
Perfect.
I don't have to do any Botox up here, huh? Because you can